Hello and welcome. Today we're diving into a condition called Steatorrhea, often characterized by the presence of excess fat in the stool. We'll explore what causes it, how it affects the body, and what can be done about it. So, let's begin. Steatorrhea isn't a disease in itself, but rather a sign of an underlying problem. It primarily arises from conditions that interfere with the digestion or absorption of fats. Common culprits include pancreatic insufficiency, such as in chronic pancreatitis or cystic fibrosis, where the pancreas doesn't produce enough enzymes to break down fats. Other causes can include celiac disease, which damages the small intestine lining and hinders nutrient absorption. Bile acid deficiencies or blockages in the bile ducts can also lead to steatorrhea, as bile acids are crucial for fat emulsification. Less common causes involve certain medications, bacterial overgrowth in the small intestine, or intestinal resections. Now let's get into the nitty-gritty of how steatorrhea develops. Normally, fats are broken down by pancreatic enzymes, primarily lipase, into smaller molecules that can be absorbed in the small intestine. Bile acids play a crucial role by emulsifying the fats, creating smaller droplets that lipase can work on effectively. In conditions like pancreatic insufficiency, the lack of lipase limits fat digestion. In celiac disease, the damaged intestinal lining reduces the surface area available for absorption. Similarly, if bile acid secretion is impaired, fats aren't properly emulsified, leading to poor digestion and subsequent excretion in the stool. Pinpointing the exact frequency of steatorrhea in the general population is challenging because it's a symptom, not a diagnosis. Its prevalence largely depends on the underlying conditions that cause it. For example, steatorrhea is common in individuals with cystic fibrosis or chronic pancreatitis. Similarly, it's a prominent feature in untreated celiac disease. Therefore, understanding the prevalence of the underlying conditions provides a clearer perspective on the potential occurrence of steatorrhea. The most obvious sign of steatorrhea is, of course, fatty stools. These are often bulky, pale, full-smelling, and tend to float due to their high fat content. You might also notice that the stool is difficult to flush away and may leave an oily residue in the toilet bowl. But the symptoms don't stop there, because fat malabsorption can lead to deficiencies in fat-soluble vitamins like A, D, E, and K. You might experience symptoms related to these deficiencies. This could include night blindness of vitamin A, bone pain or weakness of vitamin D, neurological issues of vitamin E, or easy bruising or bleeding vitamin K. Other general symptoms of malabsorption, such as abdominal pain, bloating, gas, and weight loss, can also occur. Diagnosing steatorrhea involves a combination of stool tests and investigations to identify the underlying cause. The most direct test is a stool fat test, where a stool sample is collected over a period of 1 to 3 days and the amount of fat is measured. A fat content of more than 7 grams per day is generally considered abnormal. If steatorrhea is confirmed, further tests are needed to determine the root cause. These may include blood tests to assess vitamin levels and pancreatic function, imaging studies like CT scans or MRIs to examine the pancreas, and endoscopic procedures such as upper endoscopy with biopsies to check for celiac disease or other intestinal disorders. While there aren't distinct types of steatorrhea based on the symptom itself, we can categorize it based on the underlying cause. So, we might talk about steatorrhea due to pancreatic insufficiency, steatorrhea due to celiac disease, or steatorrhea due to bile acid malabsorption. Understanding the specific etiology is crucial for targeted management. The primary goal of treatment is to address the underlying cause of steatorrhea. For pancreatic insufficiency, enzyme replacement therapy is often prescribed to help digest fats. For celiac disease, a strict gluten-free diet is essential. If bile acid deficiency is the issue, medications like bile acid sequestrants may be used. Furthermore, addressing any vitamin deficiencies through supplementation is crucial. A low-fat diet can sometimes help reduce the severity of symptoms, but it's important to ensure adequate nutrient intake. Working with a registered dietitian is often beneficial to create a balanced meal plan. While not always preventable, some measures can reduce the risk of steatorrhea. Maintaining a healthy lifestyle, avoiding excessive alcohol consumption, which can damage the pancreas, and adhering to a gluten-free diet if you have celiac disease are all important. Early diagnosis and treatment of conditions like pancreatic insufficiency and celiac disease can also help prevent or minimize the development of steatorrhea. The prognosis for steatorrhea depends entirely on the underlying cause. If the underlying condition can be effectively treated, the steatorrhea may resolve completely. For chronic conditions like cystic fibrosis or chronic pancreatitis, steatorrhea may be a long-term issue requiring ongoing management. Research continues to explore new and improved methods for managing pancreatic insufficiency and other causes of fat malabsorption. For instance, newer enzyme formulations and targeted therapies are being investigated. Additionally, advancements in diagnostic techniques allow for earlier detection and more precise management of the underlying causes of steatorrhea. Staying informed about these advancements and working closely with your healthcare provider can help optimize your outcome.